My name is Amy Shapiro. I'm a pediatric hematologist. I am the medical director of the Indiana Hemophilia and Thrombosis Center. I have been practicing pediatric hematology for approximately 35 years. I became very interested in patients with plasminogen deficiency approximately 19 years ago when I met my first patient who was affected with this disorder. The main challenges for patients with plasminogen deficiency are one, adequate and timely diagnosis. They often present with symptoms in a variety of different tissues or organ systems, and because of the rarity of the disease, the clinicians that see these individuals don't recognize these symptoms as those related to plasminogen deficiency. The most common symptom that patients may have is something called ligneous conjunctivitis, or lesions within the conjunctival membranes of the eye. They present with woody growths that are visible on conjunctival surfaces. They cause irritation of the eye, tearing, and can lead to corneal involvement and loss of vision. However, there are symptoms of this disease in other organs and tissues which can occur, including the ears, the nose, the mouth, oral pharynx, the respiratory tree, the genitourinary tract, and the GI tract, as well as the skin. Because those areas are less common in terms of manifestations, they may be less well recognized and can lead to tissue damage and problems that the patients experience in the long term. The time at which patients are diagnosed from onset of first symptoms is widely variable. It can be months, it can be years. Delayed diagnosis leads to more damage within the tissue if the disorder is not recognized. The second part of the issues in terms of diagnosis is when patients become symptomatic. Patients do not uniformly become symptomatic at a specific age. Symptoms can present throughout their life. They can wax and wane. They can be manifest for a period of time. They can disappear or regress and then reoccur at a later time. So that it's not a predictable disease necessarily for each individual or for the group of patients as a whole. For many years, we've used nonspecific medications which may help control some manifestations but really don't adequately treat the underlying problem for these patients. Recently, there have been some clinical studies using plasminogen concentrates either topically in the eye or through another company or biopharmaceutical agency in intravenous replacement therapy for patients who have more systemic symptoms of the disease. These agents have proved to be far more efficacious and beneficial to patients than previously non-specific therapies that have been utilized. Another difficulty in treating these patients is that they often come to you late after many months of trials of therapies that are nonspecific or surgical procedures to remove lesions. Surgical procedures, if not done under the cover of some form of therapy that could raise the plasminogen level, will lead to more rapid regrowth of the lesions and more tissue damage, and this can lead to more problems that patients experience in the long run. Because these patients experience symptoms in a variety of different tissues or organs, they may present themselves to a variety of different practitioners who likely do not have experience with this disease. Patients with ligneous conjunctivitis may see their primary care physician or pediatrician as a first point of evaluation. They may be referred to an ophthalmologist. But again, because this is a systemic disease where other tissues and organs can be affected, it's very important that an individual, such as a hematologist, be the person who is the central point for care of these patients so that they are aware of the other signs and symptoms that a patient can develop and make appropriate referral and care plans to adequately cover the patient for any intervention.